Palpating and treating the thoracic intercostals. The intercostals are a really big muscle required for transmitting force throughout the thoracic spine. A lot of individuals who are really into fitness, squatting, front squatting, cleans, presses, all of that, don't realize that the intercostals are very important muscles to be able to hold a barbell, whether it's in a front squat position or a back squat position. Also, if someone's doing the thoracic rotation test and they point the intercostals, you know that the intercostals are probably a part of what's restricting them. So you might be surprised at how often you start treating the intercostals once you get some effective treatment and realize it increases thoracic rotation range of motion, or people can breathe easier, or when they point the symptoms at a specific spot, it's probably a good time to check the intercostals. I'm going to first show you how to treat it with your hands, and then I'll show you how to use the pressure wave. Since we've got the pressure wave, we haven't been using our hands. I don't think much at all. Maybe yesterday I did a little bit with my hands. I don't remember. Oh, I treated an individual with the pressure wave and he still had the symptoms. And then I got in there with my hands and it cleared out the symptom. It felt like he had a nerve entrapment inside the intercostals. So yesterday was the first time I treated someone with my hands in a while. But generally you're going to use the pressure wave because it's just really effective here. There are three different layers of the intercostals. The external is the most superficial, internal is deeper to that, and the innermost is deep to that. The internal intercostals go in this direction, so I always think going internal like you're in prayer position, so it's going that way. The external intercostals go that way. We're generally going to treat the external intercostals, and you're often going to look to treat them off to the side. Usually people will point to the side in thoracic rotation. So Robert, our lovely, beautiful patient here, is in side posture. This leg is hanging down. It's bringing his pelvis shifted that way. When we're doing the pass, Alista is going to either pull from his shoulder, his humerus, or just grab his rib cage here and bring him posteriorly and a little bit up. So it's creating this type of motion. So here and here is lengthening the external intercostals the most. I drew a line for where I felt one of the ribs, one of the intercostal muscles. This is the orientation of the internal intercostals. This is the orientation of the external. Because I'm going to be going posteriorly with Alyssa as she's pulling Robert's arm back, we're generally treating these external intercostals that are going to be pulled like that. And my tension is going to be at the bottom, right above the bone, and it's going to be going up in that direction. So I'm going to set up here on this line. I feel the bone here. I feel the meat here. I feel another bone right there. So right here, I'm at the intercostal, and I'm sinking my depth towards the bottom of the bone. My left knee is bent awkwardly. I could have him move backwards on the table, but I want to block his pelvis so that Alyssa can rotate him backwards. So from here, I'm sinking my thumb edge. I'm using this part of my thumb to sink above the bone. I'm using my piezoform to just gently choose my depth. And then when I take my tension set, I'm going up in that direction, just like those fibers. And I'm applying a tension set, and I needed to feel pushback. So I'm waiting until I get the right pushback. I like that one the most. Good. Go ahead, Alyssa. Not too fast. And now I'm moving my whole body. And now I'm externally sliding a little bit because I have to catch up with his ribs. And I'm feeling increased tension as I go. So his ribs are going like that. I have to make sure I'm sliding with it. The adhesion is going to be running away from me. So I have to move over the skin a little bit. Let's do that one more time, Alyssa. And remember, just try not to extend them so that sternum's not lifting. So just straight back that way. Okay. So I'm sinking down into the tissue. That depth feels good. Tension set. I like that one. Go ahead, Alyssa. And I'm moving. Feeling increased slide. I'm feeling tension. I'm moving my arms. Good. So it's basically my hands are here, and I'm moving them with me. And as the motion continues, it becomes easier because right now my left abs are really contracted. But as Alyssa moves Robert's ribs towards me, it becomes easier to maintain my center of gravity. So you just want to be mindful of increasing the slide and tension. Robert, come on up for me. Come and stand here and face me. Good. So you can also check somebody's ribs, whether they're lying supine, they're seated, or they're standing like this. So the ribs just wrap around the rib cage, and I could just feel for tension in the ribs. And when somebody has bad adhesion, you're not going to be able to push into the ribs as well as if they didn't have adhesion. So this is something that you will just check them standing, seated. You can also do underneath the pecs. Robert has really big pecs, so I'm having trouble getting underneath the ribs. So he has a certain level of tension in this rib. And then if I have him keep your feet where you are and just rotate this way, this is tensioning the external oblique more. So if that increases tension to the external obliques, and I might treat him in this position, rotate that way. Keeping my finger in the same spot, there's less tension when he rotates to the right. So the internal oblique's not an issue. Come on back. So let's say that I want to treat this spot. Where's the marker go? Here it is. So I want to treat this spot right here, right now with the pressure wave. So I have Alyssa come and support his low back. Robert's not going to move at all. I'm going to set the pressure wave on intensity 4. Get a little bit of gel. Put it right on our spot. And as Robert's at end range of rotation, he's going to try to encourage more rotation, because if it breaks any stuff up, we want to get the tissue has to pull fully tight in order to break the adhesion. So go ahead and rotate as far as you can to the left, Robert. Upper body, yep. And then I'm treating right along that rib. It doesn't always necessarily feel good. My finger is right next to the head of the instrument. I'm trying to feel it soften. Just encouraging them a little bit more. That's already softened. I'm done there. That was 250 pulses. If I had a bunch of spots marked, I would just keep him there. Alyssa would just keep encouraging rotation, and I would just go to the next spot. I might do 3 or 4 different spots right here, get them all to soften, then remeasure thoracic rotation and see if I got it. So indicators for this: restricted thoracic rotation, but also just palpating tension, or during whatever their provocative movement is, if they just point to one of the ribs, that's a good indicator that you should probably check it. This is palpating and treating the intercostals with our hands and with pressure wave. And one more thing before I go. If they're really lean, you could also just get in there with the grit bar, and you could try scraping it in that end range position that we treated Robert's ribs with, and you will just use the system to pull the rib apart and see if it pulls tight. If you get grit, you're getting adhesion. Go get them.